Hi everyone, it's me, Melanie, your IVF nurse, and on today's segment of You've Got Questions, I've Got Answers, I'm going to be talking about Zika virus. Now, in Ontario, winter is coming to an end, even though we are officially in spring. However, we've still had a lot of winter-like weather. So I'm sure a lot of you are just itching to get that sunshine, just to feel that warmth on your skin. But planning pregnancy and traveling to a destination affected by Zika is really not recommended, only because of the risk that it poses to your unborn child. So let's start. What is the Zika virus? Zika is a mosquito-transmitted disease, and in order for you to be affected by this, you would need to be bitten by an infected mosquito. Once you've been exposed to Zika, so if you've been bitten by one of these mosquitoes and you're sexually active with your partner, this can be transferred to your partner. Clinics will recommend either abstinence if you've traveled. For women, it is 8 weeks from the time that they've returned from their travel. For men, because Zika can live in the sperm up to 6 months, they recommend the use of condoms if you're sexually active, or abstinence to prevent transmission to one another. Symptoms of Zika include mild flu-like symptoms such as joint pain, fever, red eyes or conjunctivitis, and possible rash. So what does this mean to women who are planning to become pregnant? The threat of Zika virus to a pregnant woman or someone who is in contact with Zika just prior to conceiving can end up giving birth to babies with microcephaly. This is a birth defect where newborns are born with small heads. They will have abnormal brain development. I have included a couple of photos that were found on the internet to give you an example of what a newborn with microcephaly looks like. I have included a slide with the information for the Center of Disease Control, where you can actually go on and log in and type in your destination, and it'll advise you if it's affected by Zika. It also has a map that they can show you the areas globally that are affected by Zika. If you've got flu-like symptoms and you go to your doctor and say that you've been traveling, they can do a blood test to assess for Zika virus. Common treatments for this: Tylenol, fluids, and rest. Here are a few tips to prevent Zika infection. Avoid traveling to areas that are affected by Zika. If you're in the area that is affected by Zika, you do want to wear proper clothing to protect yourself from any possible mosquito bites. So long sleeve shirts, pants, using an insect repellent. You want to be able to protect yourself day and night. When you're entering in and out of your place of accommodation when you're traveling, potentially mosquitoes can get in, so you do want to possibly use any kind of netting to protect yourself against the mosquitoes while you're sleeping. I hope you found this information helpful. Please feel free to email me at yourivfnurse@gmail.com. You can check out my website at www.yourivfnurse.com. You can subscribe to my YouTube channel, comment down below, and you can also find me on Instagram at yourivfnurse. Thanks for watching.